Three, two, one. Hi everybody, I'm Einstein Surfer. An Einstein Surfer? What the heck is that? What is an Einstein Surfer? Well, if you're interested in finding out, leave a message in the comments and we'll talk about it on a future video, if you're interested. Anyway, I just wanted to introduce myself and lay out the format of this channel. I'm one of those guys that's been a lot of places and done a lot of things. I was in the military for a while right out of high school. Stayed in, got out, worked some odd jobs for a few years, and then found my life's calling. I started nursing school in the mid-1980s at a time when the field was still probably 75% to 80% women at least. And over the next 20 plus years, I worked in emergency rooms of the local hospitals. Had at least 2 jobs going at any given time. I was always a workaholic and, a real adrenaline junkie, let me tell you. Everything from taking care of newborn babies to 100-year-old patients. I've just been blessed in my career to have gotten a huge amount of experience taking care of probably every kind of patient that I can think of. As I got older, it got to the point where I just couldn't physically keep up anymore, working in the ER, 12, 16-hour shifts, 5-7 days a week sometimes, just like I said, real workaholic. And it took a huge toll on me, physically and emotionally, as you might imagine. But during, my nursing career, as time went on, my gung-ho attitude slowly faded and tapered off, as it always does. And I began to see things, that I really wish I hadn't. Drug representatives, medical equipment representatives and salesmen, especially back in the 1980s and, really early 90s. Man, it was Wild West. I mean, hospital executives and doctors were getting vacations. They were getting to go on retreats and, conferences that they wrote off on their taxes or just got, straight out paid for by these guys. And all they literally had to do was show up and sign in. These, representatives, they'd be bringing huge meals to the floor, for all the nurses and staff. And, just so they can present some kind of, education about the latest and greatest drug or new machine, heart monitor or ventilator or whatever. A great author one time said that it was the best of times and the worst of times. Well, it sure as hell was. Well, so I became, pretty jaded by just, a lot of things and, unnecessary tests and medications and treatments, that I saw just increase. The hospitals are just, the doctors are just under increased, incredible pressure for that. And, honestly, about, 2005, I guess, I really reached a breaking point in my career when my dad was diagnosed with terminal brain cancer. And, of course, by then I'd already seen, how the medical, pharma, food complex, treats people. They always, want you to have the most expensive drug, the most expensive procedure, and treatments that you can have, in the hospital. That's just how it is. But, whenever my dad was sick, it was like sharks circling, blood in the water, always dangling false hopes to, my willing and gullible family just so they'd allow them to do more treatments. And that just hammered that home to me, on a personal level. Of course, my dad was never going to get better. The type of cancer he had, has a 100% chance, of fatality. I mean, no matter the treatment. They knew that, but they didn't care. They just kept coming at us. I'm sorry, folks, the tumor's back. Let's do another surgery. Let's do another round of radiation. I mean, it just felt like a feeding frenzy, which is what it was. So, I seriously contemplated getting out of nursing altogether. I was just that sick. And of course, my dad passed away, of course, with that cancer, which, again, 100% fatal. And I was just sick of it. So, I left the ER. I mean, I did. And I left the ER left the hospital, haven't been back, just haven't worked at all. Just stopped, sick of it. So, I started drifting. Like I said, I was contemplating getting out. So, incredibly, I started doing hospice. Did that for about a year. And as weird as it sounds, with my dad having died of cancer, not, too far behind, before that, it just, brought me peace, dealing with the patients and their families. You know, I always tell people it was the most godly job I've ever had. It just, you're doing good, and, you're being honest with people, and that just, spoke volumes to me. But, as things happen, life happens, and, I left that job, not because my feelings for the job changed. It's just that the particular company that I was working with at the time was, small, and, really the competition is really intense, among hospice companies, again, business. And, we were doing everything. I felt like we were doing everything we could, for the patients and the families, really above and beyond, honestly. It's just that the company was on, shaky financial ground due to the competition. Some of the other hospice companies were huge, and, we were in danger of getting gobbled up by a much larger company, and I really, really did not want to work for them, just, because of career experiences with them in the past. They're not all created equal, let me tell you. Anyway, that other outfit, the larger one, was really kind of like everything I'd come to loathe about the medical, pharma, food, industrial complex. And that I just wasn't going to do that. So, a friend of mine who was a director of nursing at a local skilled nursing facility called me to come tour her facility, which I did, and she offered me a job in nursing administration. Didn't really want to do that, but, it's different. So, I liked what I saw, so took the job, and very glad I did, because that brought me to where I'm at today. That was about 2007, I guess. It was. Anyway, started that job and pretty quickly realized I didn't want to be in charge. Just didn't. Too much, staffing, people calling in, this and that. Didn't really want to be in charge. However, I really did fall in love with that skilled nursing facility, because, probably like you, I had the impression that it was a nursing home. And before I did the tour, I started, I saw what it was, honestly. But, most people, whenever they hear, nursing facility, they think nursing home. It's where dementia patients go, and people who can't feed themselves. And yes, there are patients like that, but the facilities that I'm talking about, which are the majority of the ones that are out there now, skilled nursing facilities. This is a completely different world. I mean, they basically take in patients from hospitals who are not sick enough to still be in the hospital, but too sick to go home. They need more care. They need physical therapy, occupational, speech therapy, IV antibiotics, for an extended period of time, just things that they can't get at home. I mean, the list goes on and on. Many SNFs, we call them SNF, SNF, skilled nursing facility. You're going to hear me say SNF, and I'm not talking about, haha, SNF, but, many of those facilities, they can provide, quite a lot of the same care that you'd get in the hospital, but really, you can't get it with home health. So the average, SNF patients are middle to older age folks, just are because of, chronic illnesses, joint replacements, major surgeries that need recuperation, extended recuperation. So the average patient is middle to older age folks that have been in the hospital and need continued, physical, occupational therapy, speech therapy if they've had a stroke a lot of times, or if they have swallowing issues. That's what we do. They come in with us, and we get them well enough to go home, and that's just what we do. So, went to work there and really liked that aspect of it. Still do. I'm a huge advocate for it. It really restored my faith in, the medical profession. It really has, because I really feel like that we do a lot of good. We're a business. I'll get to that. But we have bottom lines and all that, but still, compared to working in a hospital, we are far, far less at the mercy of the bureaucratic bullcrap that demands unnecessary procedures, ordering the most expensive medication when a lesser one will do, repeated surgeries, endless consultations. Trust me, when you're in a hospital and have insurance or Medicare, they know just how much money they can make off of you. They have people in place in every hospital in the United States that do nothing but read charts all day. And there are computer algorithms in place, softwares that they use that create a treatment plan from you. And it really is based off of your diagnosis code and procedure codes that, drive the care that you receive. And when they're done with you, they're done with you. Whenever they make that last dollar that program tells them that they're going to make off of you, they're done. They want you out. I'm telling you. And it's all because, it's all legal because the medical, pharma, food industrial complex is so rich and powerful that they have lobbied Congress for years. They have had laws changed and laws passed that allow them to screw you over like that. It is a huge racket. We'll talk about that later if you want me to elaborate. I've got just enormous amounts of anecdotal stories that I could go into over, I've been doing this since 1985, So let me tell you, it is ridiculous. However, back to the future, back to the present. I've seen physical and occupational therapists get people back home in our facilities that have had major brain aneurysms and brain surgeries, multiple fractures and, abdominal injuries, heart surgeries, just patients that without the level of care that we provide would have just literally been sent home to die. Because without us, we're the middleman basically. You can't stay in the hospital forever and you can't go home if you can't walk. So here we are. I've seen the speech therapists work with patients and get them to progress to being able to eat solid foods, after having a massive stroke that knocked out their ability to swallow. I've seen them get people, back to being able to speak that weren't able to after a stroke. And, without them, these patients would remain silent or be on a tube feeding the rest of their lives. So, again, it's a needed service. As you can tell, I'm quite the advocate for skilled nursing facilities. So anyway, back to me working in the facility. Like I said earlier, I got burned out on being a unit manager. I had 2 floors of the facility, which was exactly half of the nursing and CNA staff, managing the day-to-day issues, doing reports, working with staffing, handling problems, dealing with families, putting out fires, we call it. So it really started getting, really, sick of it. My wife and I, we had 2 young kids at the time, and, my job followed me home, just every day, every night. Stupid phone rang, texts coming in constantly, couldn't enjoy any time away from the facility, couldn't watch a kid's soccer game, just, awful. So after a while, I was, about ready to just, go work on the floor, be a floor nurse somewhere, just be a worker bee, out of the limelight, out of the spotlight, just, be a drone. But then there was a job opening in the facility that I'd been working at that I'd never heard of before. It was a job working with a team that monitors and reports the patient care that we deliver to Medicare and, CMS, the Centers for Medicare Services, basically. That report is what drives the care that patients in the nursing facilities receive, and it's unlike the way that it's done in the hospital. Yes, there's algorithms in place, but it's very cut and dried. We don't have the agenda. We can't really, anyway, if we wanted to. We have to report just the facts, ma'am. Just the facts. how many minutes of therapy they receive, how many days they get the therapy exactly. I mean, we have to literally, count it down literally to the minute and report that in. And that pretty much tells Medicare what we're doing. And that in turn, Medicare will tell us, A, what we're going to get paid, and B, when it's, getting time that we need to think about, doing a care plan to transition this patient home. And, that job is called an MDS coordinator, which stands for Minimum Data Set Coordinator, which is the report that you have to send in. And it's very detailed, but it's not rocket science. I did have to go get some specialized training and certifications from my facility company and from Medicare to be able to do that. So really, honestly, I became quite an expert in Medicare. I could literally read you, quote the Medicare Benefits Policy Manual, Chapter 8, Section 30 to you verbatim. And that's pretty much what tells us what we can and cannot do with our patients. And, like I said, that drives the care, it drives the reimbursement and, the care planning and the whole everything. And not just in our facility, but literally in every skilled nursing facility in the United States. It is literally a law that governs that. So started doing that, did that for quite a while and loved it. You wouldn't think I would, being an ER nurse and being an adrenaline junkie, but as you can tell from this, I ain't no spring chicken anymore. And quite honestly, I'm an old battle axe nurse, and I've said for years that if I had to go back and work in the ER, they'd fire me because I'm way too plain spoken. There's just no way. I can't deal with the bureaucracy and just the total bull crap that nurses have to put up with to you have to halfway take care of patients anymore. So I'm not going to do it. So I learned, took that job and thrived in it, did very well, and worked in that job for a number of years. And I learned that job from a very, very experienced lady who'd been doing it for many years. And of course, like I said, we got trained in how to do it, and had a lot of on-the-job training with her, and got certified and got a lot of experience, so that I know the ins and outs of Medicare. I just know how it operates. Well, I did that, like I say, for about 7 years, and somewhere along the line, people at corporate, they working with them pretty closely. There's people up there who supervise what we do, and they have field people that come out and deal with us in the facilities, regularly. And I think that lady that I was talking about earlier that trained me, she ended up retiring, and I took her place as the lead in the facility. And somewhere along the line, people at the corporate office saw that I developed pretty comprehensive knowledge in regards to the Medicare and Medicaid, and also the Medicare Advantage, which is going to be very important going forward. And Medicare Advantage is where we're going actually with this channel. And basically, like I said, they saw that I had a pretty unique, comprehensive skill set there, and they wanted to use me for something other than sitting in my office doing those MDS reports. So they offered me the job that I have now. And I was offered a job that I've currently been doing for the last 9 years. What I do is all day long, you can see these monitors behind me, I do Medicare Advantage and commercial insurance authorizations for about a dozen of our facilities, which encompasses about 250, maybe even up to 300 authorizations a month, which is quite a bit actually. I get those referrals from our facilities, and I deal with them and our admissions coordinators, and I also deal with the hospital case managers. They send me the case, and I look at it and go over the chart and gather all the clinical and insurance information and confirm the benefits, and then I compile that and submit an authorization request directly to the insurance companies. So I deal directly with the insurance utilization review and case management nurses that do the pre-authorizations for their insurance companies. Our company, like every other company, we have contracts with each of the Medicare Advantage insurance companies, and I negotiate with them if we need to, and that's all based on our contract terms with the individual Medicare Advantage insurance companies. It's a pretty complicated process. Sometimes the insurance companies would just rather deny or at least limit the authorizations if it weren't for me, and there are a couple of other me's in our company. I do it for one of our regions, and there's other people that do it for other regions. But if it weren't for us, we would not get these authorizations because they're very strict in the clinical information that they use to grant the approvals. And you can't just call them up and say, hey, Bobby Joe needs a authorization to go to a skilled nursing facility. No, it does not work that way at all. It's very hard, very complicated, very time consuming, and without us it just ain't happening. So the insurance companies that do Medicare Advantage, they've got their own separate agreements with Medicare. So it's not a one-stop shopping experience. I mean, I deal with all the insurance companies, and if I say an insurance company's name, it's just in a generic context. Say Blue Cross Blue Shield, their agreement with Medicare is not exactly like Humana's Medicare Advantage agreement with Medicare, and they're not the same as Cigna's Medicare Advantage agreement with Medicare. They're all kind of the same but different, and it works differently. The authorization process works differently with each of those companies. So again, they have a me, and I get to do this 250, 300 times a month. And that's just in the facilities that I serve in this region. The team that I work with, we get probably 1,000, 1,250 a month. So we're very busy. And I have to advocate many times with the insurance nurses or case managers. We'll send the request in, and they will call me on the phone and say something like, hey, this patient's not able to walk, or they're walking 200 feet. So they don't meet the Medicare guidelines for a skilled nursing facility, something like that. Well, since I know the Medicare Benefits Policy Manual, Chapter 8, Section 30, inside and out, I can argue back that based on XYZ, I think they do meet the Medicare guidelines, and I can get an approval, or at least have them send it to their medical director for review, which probably 90% of the time results in an approval. So we're pretty adept at getting these cases through and approved for admission into our facilities. And that's what my plan for this channel is, at least at this point. I just want to share some of that knowledge with you to let you know what's going on behind the scenes, so that when you or your loved one are waiting for an authorization, or why it was denied, what your rights are under Medicare, and whatever else you want to know about the process. And honestly, this has to be said. Medicare Advantage enrollments for the first time ever have in 2024 outpaced traditional Medicare membership. Over 51% of all people who have Medicare Advantage. That is huge. That trend's been growing every year since Medicare Advantage's inception in 2010. And as the last of the baby boomers retire, yours truly being one of them, the Generation X retirees, they're going to increase those numbers even more. Think about it. Medicare Advantage plans, they're administrated by traditional insurance companies: Blue Cross Blue Shield, Aetna, UHC, Humana, Cigna. That's just a few of them. There are many other companies in different states that have Medicare Advantage products. Most of us baby boomers and the Gen Xers, we've always had insurances through our work. So it only stands to reason that we will choose a product that looks, tastes, and feels like what we've had our whole working life. So another thing, what do you think is better, traditional Medicare or Medicare Advantage? I've dealt directly with both of these for many years, and all I can say is I don't really have an opinion one way or the other. There is advantages and disadvantages, pros and cons to both, and I really can't recommend one or the other. It's really up to you. I mean, make an informed decision, talk to an advocate. Try not to talk to somebody that sells the Medicare Advantage policies, because even though they say they're not for profit, trust me, they get paid for signing you up. Some way, somehow, they get paid. So you really need to do your homework on it. I mean, which one am I going to pick? I'm almost 62, so I'm really not eligible yet, and I don't really plan on retiring anytime soon anyway. But which one am I going to pick when it comes time to do it in a few years? At this point, I don't really know. I mean, doing what I do for a living, all I can say is that I'm watching the trends in both Medicare and Medicare Advantage really closely, and I'll just have to decide that whenever the time comes, honestly. I mean, I can't really say, and I'm being honest about it. And I have to say this up front. I mean, I'm not going to talk about any insurance company itself in any kind of detail as to what their, I don't know what to say, as to how their processes go, the pros and the cons of it. I'm going to try to be, generic whenever I talk about it. So whenever I, do any future videos and talk about, what happens, during the process, I'm just basically probably going to, my good old favorite is Fred's Insurance. I've said that for years, so you may hear me say Fred's Insurance, sent me a, I got an authorization for Fred's Insurance Company today. I may, say Barney Fife or something, whatever insurance company, but I'm not going to get into naming them for obvious reasons. And, quite frankly, they are, like I said, they're all the same but different. But, I'll just try to give you some insight on how the process itself works, because it is very similar from company to company. There are some nuances, with each that I'll bring out with you also. But I'm not going to, share, any, details about, one versus the other, because I'm not going to play that, game, play you against, and, any company versus the other. So, the views and opinions and general knowledge that I'm going to be sharing here are pretty much open source material. So it's definitely not any kind of company or government secrets that I'm going to be talking about. But, out of respect for my employer especially, and the insurance companies that I deal with, I won't talk about them directly, just very generic. There's a lot of insurance companies, of course, like I said, that provide the Medicare Advantage policies to folks that want that over traditional Medicare. And, like I said, they're all similar but diametrically opposite each other also. And, they all have the same contracts but slightly different. They pay us differently. Each of them pays, one versus the other. They may pay what Medicare pays. They may pay a level that's very similar to what a commercial insurance will pay. And that's, again, with the, whatever the various plan, contract is with our company. So basically, just whatever you want to know about the process, please ask. But just, understand that I'm not going to talk directly about a company out of respect for them, not to mention to keep myself out of legal trouble with them. They know who I am, trust me. I deal with almost every single company that has a Medicare Advantage plan in the states that I have facilities every single day, and some of them many times a day. So they know who I am. If there's anything else related to a skilled nursing facility that you want to know, what to expect as far as the care for the nursing care, physical occupational therapy that you might receive, just let me know in the comments, and I'll do my best to help you understand that process also. If there's anything else you want to know about in relation to Medicare, hospitals, and the medical pharma industrial complex, hit me up in the comments. I've got some doggone strong ideas on all three of those industries. Each segment of that monstrosity, they lobby Congress to change the rules, change the laws governing food labels, use of medications, not to mention the fact that they each and indeed all are the main funding sponsors for medical schools, medical studies, medical approvals, you name it. They do whatever they can to keep you fat, sick, and in need of their products. So we can talk about that too. They're an intertwined monster that's designed to keep you fat, sick, and keep itself fat, fed with your cash. So if you want to go down that rabbit hole, we can do that too. Also, unlike many other of these Medicare experts on this platform, which there are very many, I don't work for anybody that's paying me for my content. This is mine and mine alone. I'm not a doctor. I'm not giving advice. I'm not giving legal advice. I'm not giving medical advice or any other kind of advice. I'm just trying to help you understand what's going on behind the scenes. I'm just here to help you understand some of the processes that go on behind the scenes with the prior authorization processes for inpatient stays using your Medicare Advantage plans and commercial insurance. I do those also. So anyway, if you like what you've heard, please like, share, and subscribe. Hit me up in the comments with any kind of suggestions, any gripes, complaints, or horror stories, or success stories. Trust me, many of them out there. Love to hear it. I promise you I'll read all the comments left, and I will try my best to respond. Okay, that's it. See you on the next one.